Welcome back to Office Hours Unplugged, where we chat with researchers and PIs here in McMaster. Today we bring with us to the studio Dr. Niko Hildebrandt. Could you please introduce yourself to the audience and let them know all about what you do?
Sure. So my name is Niko Hildebrandt, but I agree the name is not easy, but and it's usually people like to put an N in between. Hildebrandt is easier, but it's Hildebrandt.
Hildebrandt.
But I work in engineering, so I'm in the Department of Engineering Physics, but also affiliated to the biomedical engineering and chemical engineering and materials engineering. And I've been to McMaster for two and a half years now. Yeah. So arrived in 2023 with a Canada Excellence Research Chair from Korea, and since then I've been building up a lab, and we're working on biosensors mainly. So we're developing optical biosensors to detect anything that is related to biology or chemistry. A lot of DNA, what you guys work on.
Yeah. And how did your, journey into academia start? I mean, well, what's your background then educationally?
Yeah. So I actually came back to engineering physics now because my undergrad was in engineering physics. Oh. That was in Berlin, in Germany. Mm-hmm. So I think after school I traveled to India and Nepal and Thailand. I wanted to become an actor.
Oh yeah.
But then afterwards I said no. That's I can't do that in my free time because some actors earn a lot of money, but most actors don't earn money at all.
That's true.
And then I was looking for what can I do, and I think my older brother was studying physics at that time. I said, well, why not go into this? But so I went to an engineering school and studied engineering physics, and then after I was finished with that, I didn't really know what to do. So then again, my brother, who was doing a PhD with he works in a company, he still does, and he worked with a professor in Potsdam, which is like Hamilton to Toronto, Potsdam to Berlin. It's the same distance, more or less. And so he took my master's thesis, and that's how I got into a PhD in physical chemistry. So then I changed to physical chemistry in Potsdam. Did that for 4 or 5 years, and then stayed in Potsdam and changed to Fraunhofer Institute. These are institutes in Germany that are for applied sciences, so that was the Fraunhofer Institute for Applied Polymer Research, where I was, I think they call it junior group leader or something like this. And there I worked for maybe 2 years or something, and lived in Berlin still. As I studied in Berlin, we always stayed in Berlin. I got to know my wife in Berlin. Our kids were born in Berlin. Yeah. But then we had an offer to go to France. So then we moved to Orsay, which is close to Paris. So it's again like Hamilton to Toronto, Orsay, Paris. And at the Université Paris Sud, it was called at that time. Now it's called Université Paris-Saclay. In Europe, they like to change the names and the logos of the universities all the time. Don't know why. And there I worked in different institutes. First an Institute for Fundamental Electronics, then Institute of Nanoscience, and then an Institute for Integrative Biology of the Cell. Then after 10 years, we moved again to Rouen, which is a bit closer to the Channel, so to like 200 kilometers west of Paris. And after 2 years there, I got an offer to go to Korea for long sabbatical mainly. It's called the Brain Pool program. So it's not that you have a brain, they give you a pool. I don't know why they call it brain pool, but it's you go there and basically the Korean Research Foundation pays you for. You have to go at least 1 year, but as Korea is quite different from Europe, so we thought let's go 2 years, and so we went with the whole family to Korea. And then after 2 years, we're supposed to come back to France, but then Canada called, and then we came here, and that's all.
Yeah,
amazing.
And how would you say the different spheres of academia in each of those countries differ? How did the sort of institutions differ in the way they ran things and the way they went about doing research?
I think they're all quite different. I mean, from when I moved from Germany to France, I thought it was different, but now having been in Asia and in North America, I think the German and the French system is a little similar. It's both a European system. It's so what I think in North America, or I don't know if it's the same in the U.S., but in Canada, I have the feeling students are very strong at pitching ideas, and especially maybe it's also because I'm in engineering, and they're really, education goes a lot towards presentation as well. In Europe, not so much, but this might have changed. It's already, I don't know, long ago that I've been there.
Right.
But I think critical thinking is more important there. And I don't say that there's no critical thinking here and there's no pitching there. So that I think students are great everywhere. It's just different systems. But I have the feeling that a mixture would be great. Because, you need to pitch your idea. It's great.
Right.
But then you also need to, you need to know what you're talking about.
Exactly, yeah. That's true.
And Asia is, at least Korea, is very different because it's very hierarchical. So you never question a professor. That's almost not possible.
Right.
And so I wasn't used to that from Europe because I always talk to my students. I mean, they can say anything, and usually when we have group meetings, and there was somebody mowing the lawn outside. I said, if that guy has a good idea, we invite him in. It doesn't matter if you're a professor or if you're a student or if you're painting the walls, whatever. It's about ideas.
It does feel a little counterproductive to not. I mean, was it that they did not invite input from students, or? No,
it's just that that hierarchy is very important. I think in some Eastern European countries, and in Poland, for example, I know that as well. Japan as well is very strong. It's just that hierarchy is strong, so you have to give your ideas.
Yeah.
And in Korea, usually they do that in beer drinking afterwards. It's this kind of a tradition that at that time you can tell anything you want to your boss. But otherwise, I think you have to see it different. So they talk, but you don't come. I did this in the idea. I was in the beginning. I gave an idea. I said, "What if we do this?"
Yeah.
And then I found out this is not the right way to address students there, because then they will say, "Well, that's the great idea." I can now not say, "Oh, that's a stupid idea. We should do it like this," right? And then I let them talk first, and then it's. I mean, they're very smart and hard workers and also camaraderie, but you don't directly say, well, that's a stupid idea. I mean, perfectly here, you also don't say directly to your professor, oh, that's a very stupid idea. But in general, everybody's,
Fair
in the
enough.
end, everybody's the same. They're all good and not the same. I mean, that's what I like most of academia, that you can work with so many young people who are all different, right? So
And given that you've been to so many different countries, was there like an experience that really motivated you to kind of go down the path of biosensors and really hone in on, the luminescence and, that kind of field?
It was, I think during my PhD, so during my master's, I was working on lasers. So I developed lasers, and that's what I started doing in the beginning of my PhD as well. We were building solid-state lasers.
Right.
For improving immunoassays, so that where two antibodies bind an antigen and there's energy transfer. And the wavelength they were using was not great, so we had a European project. We wanted to develop a new laser. And then that all worked out more or less well, but now, 20 years later, we're still using the old laser we used before. We had developed a laser eventually. Yeah. But then we found that what if we change the chemistry in the immunoassays and not the excitation laser, and that's how I came to quantum dots, which are semiconductor nanoparticles that are luminescent, and to lanthanides, europium complexes and terbium complexes,
right?
And adapt those to. Started with immunoassays, all things with DNA only came much later, but in the beginning we mainly worked with proteins and protein detection, and that's what I've been doing ever since.
Wow,
amazing.
And what would you say was like the hardest part on that whole journey, kind of like coming into your own path, so to speak?
I don't know if there was ever something that was like really hard. I was always fortunate that there were opportunities along the way. So when I finished my PhD, we just had applied for a European grant, and that grant came through. So I stayed a little bit on the grant, and then just next door in the same campus, a position for a junior group opened. So I got that, and then by talking to a colleague in the library of the Fraunhofer, he said to me, well, aren't you doing something with nanobiphotonics and your wife is French? I said, yeah. Well, there's this offer in Paris. Does it interest you? I said, well, not really, but give it to me. And then I applied, and my wife had a position at the same time in Paris. And as our kids grew up bilingual anyway, we went there. And then I think, I mean, it's always hard. So when I came to Paris, I didn't speak French a lot. My wife is French, but my French was basic. And I had to teach immediately in French. And I had to,
oh my God.
And I had to teach circuit électronique, which is electronic circuits, and, which is nothing that I'd ever done during my PhD. I had done something in my undergrad. So I wasn't sure what was harder, the language or the topic.
Right.
And but I think students appreciated it because I really focused on the topic because my language wasn't good, right? And now I'm probably a professor who's blathering all the time about stories left and right. And that might also be funny, but I think as a student, you sometimes also appreciate when the professor, at least in undergrad, sticks to the topic. And that's what I did.
Right. Yeah. And did you always imagine yourself to kind of become a PI, or were you more focused on like the research aspect of your work?
That's a good question. I don't really know. I was also, while I was doing my PhD, I was always open. So as I came from an engineering school, which is very different in Germany. So you have, when you finish engineering school, you cannot do your PhD directly.
Oh.
So during my PhD, I had to upgrade to, let's say, real masters. So my master's in engineering wasn't the same as a master's in at the university, because I went to they call it University of Applied Sciences. It's special schools in Germany, and so I did that, and I was always open to work for industry or for academia. And then I think I just got into it, and then it was fun, and then. But I think I would still be open to anything, right? If there's I don't know, maybe I'll open a bar in Hawaii one day or something.
Just go with the flow, right?
Yeah, a little bit. As long as it's fun. It has always been fun and interesting, and you meet a lot of nice people. Then I always appreciated it. The great thing is, as long as you find money, you can do whatever you want, more or less. So I mean, you have to. That's probably back to what is the hardest is finding grants and writing grants. But once you have that, then you can do what you like, and then it's almost like you get paid for what you like to do.
Yeah, your passion.
Yeah. And this is kind of like a follow-up to the previous question. What would you say have been the most challenging or hardest parts of being an independent investigator? I mean, it's probably one thing to do research as a sort of separate entity, but to actually manage a lab, that has to come with its own set of challenges, I would imagine.
Yeah, I think when I first became a PI, I thought, well, now it's done. Everybody's got to do what I want, right? Because now I'm the boss. And but it's every individual is very different, right? And you know, there's some people who are just like me, who are very different than me. It's and well, I want people not because if I have 20 Niko Hildebrands in my lab would probably be horrible. You know, I already have to look at me in the mirror in the morning. That's enough. But so I think adapting to people, adapting to groups, and or trying to adapt, because it's never, there's no formula where you say. That's it. That's how it works. Because and then it depends on the size of the group, and the different groups I had was always different challenges. So I said, well, now it's done. What's great for this group, then you have another group somewhere else, and then maybe that's also my fault because I always change places. But so if a group builds up with a different people, which is great, that's a challenge. But that's a challenge that also motivates, because otherwise it will be too boring if there are only only bots and so all these bots and AI stuff is a horror for me. If it ever goes like this, then I will definitely open an AI-free bar on Hawaii or something.
So now, like, kind of honing in on your lab in McMaster. So I know a huge focus of your lab is the application of like Forrester resonance energy transfer. Wow, that's a mouthful. So could you kind of explain your first exposure to this process and why you decided that to be kind of the main focus or like the central focus of your lab?
Yeah, so that's also something that came with the quantum dots and the immunoassays because, well, basically my PhD project was already about Forrester resonance energy transfer. So I worked with a company, they're called Cezanne. Then they were bought by a larger company, Brahms, there in Germany, and Brahms has been bought afterwards sometime by Thermo Fisher. So in biology or biochemistry, we say in the end everything ends up at Thermo Fisher because there's these big companies that buy up everything. And they had these immunoassays, and they call it homogeneous immunoassays or mix and measure separation-free assays, where you have two antibodies and you need two or three that bind a biomarker. So, for example, tumor marker or any marker for Alzheimer's. And the idea is that the two antibodies are labeled with a donor and an acceptor of this energy transfer. And this energy transfer only works when they're very close together.
Right.
So if the antibodies are free in solution, they're too far apart to make energy transfer. But when there's a biomarker inside the solution, inside the serum or blood, then these two antibodies with the donor and the acceptor will bind. And now they're close together. And then the energy transfer can occur. And that's what this assay was already about, also with lanthanides. And then we used it with quantum dots and for make it more multiplexed, so measuring different things at the same time. So one, I mean, if you want to call it holy grail or something that is impossible, is that we can measure all diseases with one assay, right? Because there's so many markers, and theoretically, practically it will never be possible, but theoretically, it sounds like a great idea. You make one test and you have all the stuff in there. And so ever since we've been trying to make things simpler and more rapid, because you don't need to separate. It's really if they're in solution or if they bind. So usually assays have a lot of separation steps. ELISAs or other assays, you immobilize something, you wash it. So students do a lot of washing and immobilizing, and these mix and measure assays just mix and measure and no separation because of the distance dependence of this energy transfer. It only works if it's close together. And that makes it more rapid and more simple and more multiplexed. And then I just applied it to anything that came along. So all DNAs, nucleic acids, RNAs, aptamers, proteins.
Yeah.
And also investigating the fundamentals of FRET. So the first resonance energy transfer, you call it FRET in short.
Yes.
So to investigate how the mechanisms work with different nanoparticles and stuff like this. So it's always I always like the mix of very applied things, maybe even try to be translational that people can eventually use it one day, but also a deep understanding of what's actually going on, because it's only really very satisfying if you understand what you're developing. And so that's really what I liked, and why we're still doing it.
And was that also the topic that you explored in your previous groups, or has it been something that you've honed in on here at McMaster?
No, this is something I've been always working on. So I've never, I've changed the materials, so that's why I'm also related to material science, because we use different nanoparticles like quantum dots, upconversion nanoparticles, gold nanoparticles, different dyes and lanthanide complexes. But I always stayed with FRET. So we wrote a book about FRET, and some people in the community even call me Captain FRET, because I came up with this, I'm Captain FRET. And here it's more to use this concept of biosensing and to work with clinicians here as well. So there's the hospitals are quite strong at McMaster as well in the clinics. So I'm trying to get these things translated also to environmental sensing, because from a biosensor development point of view, it doesn't matter if it's a chemical or an ion in the soil, or if it's something in the blood or in the air. As long as we can detect it with something, we try to do that.
And I imagine, since you're developing biosensors, and I think one of the aspects of your lab is optimizing, those sensors for real life applications. What are some challenges with kind of getting that technology into the clinical field, given that, there's so many rules and regulations?
I think the rules and regulations come in the end. I don't think that this is the main problem. I think a big problem is that people need to talk and understand each other. So
Right.
When I worked in physics before, I had colleagues who said, well, I gave this technology to the biologists and they still haven't worked on it, and it's a year, and or materials, and say, well, you have to understand them, right? They're not interested in your material, they're interested in their biological system.
Right.
And they probably have a good system. For example, in imaging, a lot of people work with fluorescent proteins, and fluorescent proteins are miserable emitters. So from the fluorescence point of view, they're very bad. But they're great because the cell expresses the fluorescent proteins on its own, right?
Yeah.
You just
Right.
program it. And so it's a cool working system. And then when somebody comes and says, well, do you want to put this nanoparticle inside? They say, well, the nanoparticle has to get in the cell, et cetera, et cetera. It might be brighter, but there's other problems with it. So this understanding of what you can do and what you cannot do and what the other person wants
Right.
is important. And it's also because, we always like to exaggerate our stuff, right? When I give a presentation, I say, well, Fred is the coolest and we can do multiplexing.
Yeah.
And it depends where I am. So when I talk to clinicians, I always try to tone down a little bit, or at least afterwards, because when the talk is over, then people approach me and say, well, you can measure these 10 things at the same time. It's whatever concentrations. Well, let's try it out first. It's still difficult. Because for sure, if I would be a clinician and say, I want to measure these 10 biomarkers and this guy can do it, well, let's do it. But it's so then to talk and to explain what can we do, what can we not do, be open to other things, right?
Right.
Even when I work with Leila Soleimani, she's doing electrochemistry. I never say that optics, well, I say optics is better, but I don't believe it. It's because some things, electrochemistry is much more powerful than fluorescence, and in others, because otherwise there would be only one technique, right? But there isn't. And so I think this understanding and getting together and understanding that it always takes time, right? You can't develop this thing because they want, or if you have a patient, right? You say, we can do this. Yeah. If you have a cancer, you're not interested in getting that stuff in 10 years, right? You want it right now. Yeah. And so I think patience is a big thing.
Fair enough.
So kind of, I guess, being on the same, having the same perspectives, right? Because the clinicians have their own, ideas, and the biologists have their own ideas, but then you have your own, expectations and your timeline, right? So I guess finding the even ground between different groups is very important, right?
Exactly, and there's a common understanding of, I possibly can help you, but I can't promise anything.
Right.
And a lot of things in science is over-promising stuff, because we're saying, these materials are the coolest materials,
right.
And so, but if you over-promise, you might, it might get sensational, and you get a Nature paper maybe eventually, but over time, people find out what these materials can actually do. And there is no perfect material. So quantum dots, for example, got the Nobel Prize 3 years ago, I think, or 2 years ago in chemistry. And they were, in the beginning, the people who developed these quantum dots said that might replace all dyes and things, but it never replaced anything. It's just another very bright nanoparticle. I mean, now you can find it in screens and things. But if you promise it too much, then the biologists will think, well, let's do it right away. And then you say, well, first I have to make it water soluble. Yeah, sure. I mean, I'm a biologist. I need it in water. And then there's many different steps. And so
there's the little caveats.
Absolutely, yeah.
And what would you say so far is the, main challenge or hurdle with FRET that you face in your research?
Well, I always say FRET can solve anything, but it's... I think, it's really dependent on distances below 10 nanometers. And so depending on how you adapt that distance, it sometimes works better, sometimes it works not so good. And so I think there's an understanding of how it works. then with a new material, it can be different. But really, in a biological system, adapting these distances, and also depends on the orientation of the donor and the acceptor, is very difficult. So in solution, when we say we have a distance of 6 nanometers, well, basically it's an average, right? It's a Poissonian distribution, and we also have some that are 8 and 10 and things like this. And I think really that's why I'm so interested in understanding things, really understanding it to then optimize it to get things maybe more multiplex so that you can measure more and more sensitive and specific at the same time. So this is maybe not related to the FRET. So FRET is just more or less a tool, and I don't want to degrade it down to a tool because I work with it. But I'm okay with using it as a tool. But understanding how a hammer works will help you to get the nail into the wood, right?
Yeah.
So if you understand it well, then you can do better things with it.
And you mentioned aptamers earlier, and you know us, we're all about single-stranded DNA and aptamers. So I'm curious, like, what's the kind of work you've been doing with aptamers? Have you kind of been looking at what they can do? Because I know your work, you use antibodies a lot, and aptamers are just basically they do the same things and antibodies can. So what's the research you're doing or have done with aptamers?
Yeah, aptamers always have this promise of that they're simple to make, which they are, but first you need to have a good aptamer, right? So that's the first thing you learn after some time when everybody says, again, overselling for aptamers that counted as well. Yeah, aptamers, they're so cheap to make, but you have to find one out of a million or a billion or a trillion, and then once you have it, that's why a lot of people in the publications, at least, who use aptamers use the same aptamer, and often they're against some ions, and then they're possibly not even very selective for this one ion. But for us, it's just a binder, right, like an antibody. So we can say, well, maybe I'm the least creative researcher in the world. I only do what others people
that's
do
how you
and,
get
and,
results.
put it together. So we just need a binder to a molecule. So an aptamer binds differently as an antibody or DNA, but it does it as well. And then if we can do the energy transfer, that's great. And DNA is so great because it's only got 4 components, so it's much easier to build than an antibody, which has 23 or 21 now. 23, I think, components. So that's and that's great to adapt distances because everything in FRET depends on distances. So that's why we like
more customizable.
You can basically tune the distance by 0.33 nanometers because that's the distance between 2 nucleotides in a DNA. And so you can put your donors and acceptors to any of those and then adapt it. And then aptamers. Well, if you have one, then they're great. Then you can work with it, and that's why a lot of people work with Ying-Fu Lee, your boss, because he's making good. Or you guys are making great different aptamers or nucleic acids in general, and then we can use it for sensing.
No, but I totally second that thing you said earlier about how they sell you with the idea that it's easy to do. And then before you know it, you're on like a 4-month just rut of like being in the same position, not being
barely
able to
any
get
progress.
That's the curse of PowerPoint presentations, right? Because on a PowerPoint presentation, a PI will always present your project like it's like this and that, and then in the end you get this and that, and then you say, well, that's cool, I'm trying it, and 8 years later you're still on slide 1.
If you're lucky, by the end of your lifetime, you'll reach the promises your PI presented to other people.
Maybe,
Well, kind of just zooming out a little bit, given that your lab is currently taking on a lot of projects, and this is a bit of a question I don't know that if you would want to give a direct answer to. You can speak more broadly here, but is there a project or initiative that your lab is pursuing within FRET research that you're particularly interested about?
Well, I think I'm interested in all things we do, and they are with FRET and without FRET, right? It's mainly about optics, and even in some essays we work with electrochemistry with other researchers at McMaster and out of McMaster. So I'm not limited to optics, but that's what I have the most understanding in. So absorption or fluorescence or FRET. Sometimes you don't even need FRET. If the fluorescence is enough, then we don't need an extra step because an extra step makes it more complicated.
Right.
Yeah.
And as we're in engineering, and the engineering principle is always make things as easy as possible
Right.
if they work the same, right? So you don't
Yeah.
want to put 8 wheels on your car. If you can do it with 4 wheels, that's enough. Unless there's a great improvement of 8
Yeah.
wheels, which I haven't heard of. But I think what I'm very interested in is to get more connection with clinicians
Right.
and science. So I think this interdisciplinarity or multidisciplinarity, and that's what McMaster is great for, because it's a university where, at least from my point of view, people are open, working with each other.
Right.
And so one initiative that we're trying to get up right now is, we call it Diagnostics, which is to bring clinicians, scientists, or from researchers from engineering and from science together, and to build something that's more, at the moment, is probably more political stuff than actual research stuff.
Right.
But I think all these projects where I can work with someone else from science, from health sciences, in, for example, developing DNA. So we work with Catherine Bujold, who's in chemistry as well, who does DNA, and we're trying to put DNA on gold nanoparticles, which is, well, relatively simple. A lot of people do it, but as DNA is, well, you work with DNA, it's not, it's flexible, right? Especially single-stranded DNA, but we want distances that are very well defined for energy transfer. So Catherine and her group, they're building like cages that we can put on these nanoparticles, that we can tune the distances of our fluorophores on.
Right.
And so these things where you get to know the other side, or another side of science. This is what I like the most, I think.
I feel like I agree with that. I feel like most of innovation in general tends to come within an intersection of disciplines. And this university, from all the people that I've talked to, a lot of people have cited that as sort of their thing that they look forward to the most, is doing collaborations and stuff with clinicians and people in the hospital, because it's right there and it's connected to the whole network of systems. So I can see that being a pretty good perk to have.
Yeah, absolutely. It's working with also different people, different approaches, and but still, and that makes it difficult, because it's sometimes, I talk with chemists and they always show NMR. I never understood NMR, although my wife has a PhD in NMR, but I like that. And every time we discuss, I learn something new, and then I forget it again. But so that's also, you're always exposed to new things.
Yeah.
And given that, your work is so multifaceted, I mean, biosensors, as you said, you can basically use them anywhere. Is there any, I guess, particular disease or, phenomenon that you kind of focus on when you're working with biosensors?
A lot is often related to funding. That's as simple as it is, right? Because
we totally fair.
We need the money. So if there's funding because from a biosensor development, we just need 2 binders against something, right? And for antibodies, usually you can take any dirt that you have, inject it to a mouse, and the mouse will develop antibodies against it, and then you take the antibodies out, and then you do hybridoma technology to make monoclonal antibodies, and they can develop an assay. Or with an aptamer, you find your aptamer after all these findings and optimizations, and then you use it. But we've applied it to food sensing, for example, for measuring heavy metals in fish, or to measuring contaminants in wine, or we've mainly developed things for clinical diagnostics. So that is cancer, so different cancers: prostate cancer, lung cancer, breast cancer, ovarian cancer. What other cancers? A lot of different cancers we worked on. Alzheimer's disease we've worked on for some time. That's already longer ago, when there was a big Alzheimer's initiative in Europe, and also sensing in water. So I'm interested in that as well, because another kind of excellence research chair who's in Guelph, who came at the same time that I came, he's doing water sensing, and there's a lot of water in Canada, right? And there's a lot of dirty water in Canada as well, where you don't have the access of of measuring
Right,
it. So
yeah.
if you
Yeah.
can measure handheld biosensors, for example, that you can measure water quality anywhere, that would be great. So that's it. Always depends on also what people suggest,
Right.
right? So there, I got to know this person measuring water,
Yeah.
and well, I live in Toronto, so I
Yeah.
pass by water in the train and then on my bicycle to come here every day. So
Yeah.
especially Coots Paradise and in summer,
Yeah.
it's quite smelly. You don't even need a
Yeah.
sensor, so you
Yeah.
can you can or the bay is
You can already sense the
Yeah.
the
yeah, for that you don't need
Yeah.
a specific fluorescence
Yeah.
sensor anymore.
Yeah.
But so these are things that that come and go.
Right.
But there's
Yeah.
not one thing where I would say we absolutely focus on that. We can remain flexible.
And just kind of wrapping things up here, what would you say so far has been your proudest accomplishment in your research career, or maybe in your life in general in that aspect?
Or publication.
Our
Yeah.
location.
Yeah.
Well, in my life in general, it's my family for sure.
Yeah.
So that's got nothing to do with research. So, but I think I don't know if there's one thing. I think the entire I couldn't make it on. Sometimes I have the feeling that this paper I like, and when I have a new paper and it's very long, and then I think, well, this is cool. But then I look back to other papers and people I meet. But I think if you focus on one idea, or if you say, well, this is the proudest thing and this is what I base all my motivation on,
Right.
that won't work, because most of research is very demotivating, because 95% you don't find what you want to find, and you have to be happy with the 5%. So you have to be happy with different things, and you have to be proud of different things. But
Right.
definitely all the time, a student graduates, or a student, I mean, now, because I'm an old person now, I have students who are professors somewhere else, and they're doing great research, and there I would say I'm proud of something.
Right.
But already I don't like the idea of pride so much. So things like pride and leadership are things that I almost despise, because I think it's better to be a thinker than a leader,
Right.
and it's better to be humble and think something is working well
Right.
than being too proud of things. Although it's not bad to be a good leader and to be proud of something, and I'm not saying that, but it's I think sometimes people focus too much on, I'm so proud of that Nature publication. And then you say, well, why aren't you proud of the research you did for that
Right.
Nature publication in the first place, or whatever? But yeah,
Think-
sorry, I don't have
No,
an
no,
answer.
no,
for that.
that's
So
a
you
good
think
point.
more so to focus on the journey rather than the end result is
Yeah, or several,
Yeah.
and because
Yeah.
there's because often when I talk to students
Yeah.
as well, they said, well, I only did this and that, and I wanted
Yeah.
that. I said, well, if you have the perfect paper where you find everything already, then your career is basically over, right? What do you want to do? So
Fair enough.
we're publishing one thing after the other to
Right.
always learn more.
Yeah.
And yeah, if you understand everything, well, then you have to stop. Then it's back to
Right.
the bar in Hawaii, because you've accomplished anything you can in research.
You made like a really good point, because I feel like, now you mention it, like if you're stuck at that one moment, right, I feel like that'll stop you from growing and pursuing more, right? Because it kind of goes back to science. It's all about lifelong learning, right? Like no matter how long you've been in the field, there's always more you can learn, always more you can do. So kind of being stuck on one thing is, I guess, would be inhibiting your growth in a way, right?
Absolutely, yeah, but then you're also always limited by the amount of funding or
Right.
support you have, because sometimes you have to focus on one thing, right, and say we want to find that. But it's cool if you don't have to stick with this and grow and learn new things, and then turn your page and
Right.
do another thing. And a lot of people even change completely, right? As I said, I always did Fred since my PhD studies, but it's in different directions. So keep it versatile and flexible. But I think change is always a good thing.
Yeah.
Positive change, not negative change.
All right. I guess we'll leave it there. Thank you so much for joining us today, Dr. Niko Hildebrandt. I hope I said that right.
That
or
was
at least
that was pretty good. Yeah.
better than he did.
Better than me.
Thank you for coming down here and talking to us. I hope the trip down here wasn't too bad. And Thank you to everyone listening, and we'll see you next time on Office Hours Unplugged.
Thanks a lot for it. Was great here.
Yeah.
I love your studio.
Thank you.
Glad to hear that.
Thanks.